Berkeley, thank you for joining us for this virtual town hall on the City of Berkeley's response to COVID-19. I'm joined by our city manager, D. Williams-Ridley, who is acting as the Director of Emergency Services during the state of emergency, and the City of Berkeley's health officer, Dr. Lisa Hernandez. Thank you both for joining us. I know you have an incredibly busy schedule responding to this emergency, and really appreciate you joining us to answer questions from Berkeley residents. And residents had an opportunity to submit questions online, received over 50 questions. We will do our best to get to the questions this afternoon. And many of the questions were around similar topics, so we may group the questions so that our guests can answer them for you. Before I turn it over to Dr. Hernandez to give an update on the number of cases in the city of Berkeley, as well as the recent order that she had issued yesterday, requiring that residents wear facial coverings when they go outside their home, and any other updates she'd like to share with Berkeley residents. I just want to thank our incredible staff who have been working tirelessly since the end of January to respond to this growing public health threat. And I'm really proud to be mayor of Berkeley at this time and be part of this organization with dedicated, hardworking, brilliant staff who have been working night and day to keep our community safe and to put in place rules and programs for our community to not only continue to function, our government to continue to function, but also for our residents to be protected and be safe during this difficult time. And I want to also acknowledge the incredible first responders and frontline medical staff that are working hard to treat those who are sick, to care for the family members of those that are sick, and also to help keep our community safe. And lastly, I'm really amazed by the generosity and care and concern of our Berkeley residents during this time. Residents have been organizing drives to donate personal protective equipment. They've been sewing masks for their fellow neighbors, have been volunteering for organizations like the Berkeley Food Network to provide meals for our most vulnerable during this time. And also I've been donating to our Berkeley Relief Fund to support our small businesses, our arts nonprofits, and residents as well. So I really do think it's in times of crisis that our community really comes together and really shines and really brings out the best in all of us. And I'm just really inspired by how Berkeley has responded to this crisis. And I'm confident that we will get through this and we'll be even stronger and more resilient at the end of it. As we know, sadly, a week ago, a Berkeley resident did pass away due to complications related to COVID-19. I just think that reinforces the importance of us to take very seriously the directives that have been issued, to stay at home unless it is necessary. And when you do go outside, to wear a facial covering and to ensure maximum physical distancing from others. This is intended to protect you, protect your family, and protect your fellow neighbors, so we can reduce the spread of this virus in our city, and also to help flatten the curve. And I'm actually been amazed that as a result of our early intervention, that we are helping level off the curve. But we need to know that all we're doing is reducing the number of cases and leveling the curve. When the shelter-in-place order is lifted, people are still going to be susceptible to contracting COVID-19. And so it is essential that we take very seriously the public health directives and precautions that have been issued to wear facial coverings, to ensure physical distancing, even after the shelter-in-place order is lifted, so that we can keep each other safe. So thank you for joining us. We're going to get to your questions very shortly. With that, I'd like to turn it over to our City of Berkeley Health Officer, Dr. Lisa Hernandez, to talk a little bit about the current number of cases, confirmed cases in the City of Berkeley, to talk about the recent order that was issued requiring that residents wear masks when they are outside, and anything else you'd like to share with Berkeley residents.
Good afternoon. And before I go into the updates and the cases, I definitely want to echo the mayor's gratitude and thanks for the residents of the city for abiding by the shelter in place order and largely starting to do more masking or face covering your face while you are out in public. So I will talk a bit about that. Because I know a lot of the questions were specific to the my recent order that was issued yesterday. So I have the order here. We can talk more about that in my update. And then if I haven't answered any of those questions in my update, I'm sure the mayor will review those questions so I can answer them. So let me get to the data. Currently in the United States, there are over 690,000 cases of coronavirus that have been confirmed in the United States, with over 35,000 deaths. In California, we have over 27,000 cases with nearly 1,000 deaths, 985 deaths in the state. In Alameda County, there are 1,021 cases that are confirmed of coronavirus and 39 deaths. And those do not include our numbers here in the city of Berkeley. So for city of Berkeley, we have 42 confirmed cases and one death. And I want to point out, I know there was a question, I believe, about homeless cases in those experiencing homelessness. And of those 42, one of those cases is in someone who is experiencing homelessness, and that was identified through some of the work that I will talk about in a few minutes in my update. But going back to the data, another question I know people have asked, and we're going to start updating our website on this, is how many tests have actually been performed on City of Berkeley residents. So what we get in public health are through my one of my earlier orders is number of all tests that have been performed on any resident in the city of Berkeley. So even if you got tested in Walnut Creek and you live in the city, the lab is required to report to me that you were tested. So it doesn't matter where you were tested. It doesn't matter whether you were tested and you didn't have COVID-19, the lab is required by the health officer order to report to me. So with that information, I want to let you know, as of April 16th, there have been 795 tests that have been completed in City of Berkeley residents. Of those 795, 40 were positive. And that's a little different than the 42 cases that I mentioned, because 2 of the 42 are cases from the Grand Princess, which was one of the cruises that was stationed here in California. And we had 2 residents that were not our, 2 people that were not our residents that were in our jurisdiction and cared for. So we counted that as a case because they were people that were for all intents and purposes for that time, our residents while we cared for them. So of the ones that were tested here in Berkeley, those were 40 that were positive, and that gives us a positivity rate of about 5%. If you look on other data dashboards, you will see that the rates for other jurisdictions are about 10%. So we're seeing a lower positivity rate. So we'll see how the trend goes, but we are monitoring that, and we're going to post that starting on Monday on our page. In terms of other data, we posted yesterday on our open data portal our cases. You can look there for daily cases. That's also in the same section where you see our case counts. And then we hope in a week's time to have a dashboard, which is going to be more user-friendly display of data. So that's to come, but I wanted to mention that to you today. In terms of our response, we are focusing, are focusing on certain high-risk populations, especially skilled nursing facilities and those older adults, as well as those that are unsheltered, that are either in encampments and in shelters. And we have response teams that go out and support and assess any of those venues, whether it's a skilled nursing facility or if it's an encampment. And in the encampments and in shelters, especially in their shelters, there was an effort that was initiated last weekend where high-risk individuals were being identified, assessed, and then placed into hotels in Oakland through an effort called Safeground and a partnership between Safeground, Alameda County Healthcare for the Homeless, and City of Berkeley. And through that effort, that's where an individual was identified and tested, and that's how we were aware of someone who was positive with COVID-19. I want to assure you that we didn't stop there. We did, as we do for all cases, we do an investigation. We interview the individual, we identify contacts, and then we do the additional steps to identify any additional contacts and cases. And that is exactly what happened in this individual case, where we did work with the individual, did an extensive interview. We worked with the shelter, did interview and assessment on site. I personally went on site to do that. So that is what we do in these cases, and a little different with people who are living in congregate settings, such as group settings, such as long-term care and in shelters, where we wouldn't be going to your home if you were a case. We would still do contact investigation and tracing. So that's the difference, but I wanted to assure you that that's what occurred and what will occur as always going forward. Just two more things, Mayor. One is about testing. As you know, we set up the test site in Berkeley on 6th Street, and that is through a partnership with University of California, Berkeley, and Lifelong Medical Care. We are hoping to expand the testing there at that site to include all essential workers, not just those that are City of Berkeley employees, and other folks that are first responders, and then high risk individuals who are all symptomatic. And our plan is to open that up next week sometime. And it will not matter what your insurance is. If you are symptomatic and you fall into those categories, we are hoping to test you. And we hope to expand it even more, but we're focusing on high risk and symptomatic at this point. Then I will talk about health officer orders. As you mentioned, there were 2 health officer orders that I issued this week. One was specific to skilled nursing facilities and residential facilities, which required them to have individuals mask, workers, as well as those that our residents, as well as a number of other actions, such as screening visitors and residents and staff, as well as reporting requirements. So that was issued on Thursday. On Friday, there was a health officer order that I issued in terms of requiring masking while in public. And I can go through it, but I don't know, Mayor, if you want me to go through it or just go through some of the questions that people have.
I think a lot of the questions do relate to the issue of masking. And so when we get to those questions, if you can elaborate on the recent order, we would greatly appreciate it.
Okay, great.
Thank you so very much, Dr. Hernandez. I'm now going to turn it over to our city manager, D. Williams-Ridley, to give an update on the City of Berkeley administration's efforts to respond to COVID-19.
Thank you, Mr. Mayor, and thank you so much for bringing us together for the town hall meetings. I think it's really important and it provides a lot of information for the community. And thank you to Dr. Hernandez for her amazing work so far. And I anticipate even that work will go beyond anything that we've experienced here in Berkeley. One more thank you going to our council and our amazing staff in Berkeley. We're all working so well together. We're putting out a lot of work and information, and we're working in a way that's collaborative for both the staff as well as the community and the council. So I'm very, very proud of the work that we're all doing together. I want to focus on just 3 areas this morning. As you know, our Emergency Operations Center was activated in early January. I believe we were one of the first cities around the state of California to do so. I think that has positioned us in a very, very important position to where we are now we're not in a reactive mode. We're being proactive, looking ahead. We're moving into the arena of thinking about post-COVID-19 and putting together a plan to address how we re-enter into some form of normalcy, and also how we look at the community needs as we progress to that state. So right now in the EOC, as Dr. Hernandez mentioned, we've been moving the unhoused to safer ground. And I just want to highlight some of the really important reasons on why that's critical and important for that regional effort and the success of it so far. This program basically transport allows us to decompress our existing shelters. It reduces people in our shelters and thereby reducing the exposure. So that helps out a lot in making the people that are in the room together, less of them, so that they have less of a chance of exposing one another. It particularly reduces risk to the most vulnerable and unhoused, those that have chronic conditions or they're over the age of 65. So we're concentrating in that arena. It also illuminates yet another benefit of the innovative work that's happening with our partnerships with UC Berkeley and Lifelong to set up the testing site here in Berkeley for Berkeley residents, for Berkeley first responders, and for our essential service workers. So we're really excited that that is underway and moving forward and progressing very nicely. This also strengthens our relationship with the county to both COVID-19 and to our homelessness, and provides a model for effective partnerships. I know a lot of people talk often about we really need to be more regionalized around our unhoused, and that is absolutely happening today. Now, I want to just put out there that not everyone who is unhoused will be interested in this. And we're seeing that across the region, that there are folks that just aren't interested in being put into a hotel or quarantine for a number of reasons. But I do want to encourage our activists, our supporters out there, for our homeless community, for all of you who come in contact with our unhoused community, please encourage them to take this opportunity up and to get out there and find a way to get into a safer ground environment for themselves. As I stated, and as Dr. Hernandez stated, we basically transported 18 medically fragile people who were unhoused to the city testing site and then to a hotel in Oakland. So we're going to continue that work. We're doing that across the city. I-80 corridor, the Shell Mound at Ashby, we're on Shattuck and Dwight, and we'll be increasing our efforts in assessing in that environment. So we're working across the city. We've started with our most vulnerable in some of our larger encampments. We've also finished a lot of work around support for local businesses. We continue to work with them to manage the current long-term effects of COVID-19. As you know, we've had over 1,000+ applications submitted for the grant application program. Staff have completed the review of those applications, and I'm really excited to say that we'll be moving forward with that. And I want to thank the mayor and the council for putting this effort forward and for leading in this arena. We also help the businesses again with kind of connecting them with the state and federal resources and developing marketing campaigns so we can assist them with essential businesses. They're adapting out there. It's still tough. We have a long way to go and a lot of work to do, but I'm very proud of the team, of our Office of Economic Development team, and my 2 deputies, Paul Budenhagen and David White, who have been leading massive efforts across the city. The last message I want to share is our mental health. We've been putting out a lot of information around ways the community can stay mentally charged and mentally healthy. And please visit our website to look at ways in which to stay healthy and connected to support groups, especially your neighbors. We're looking for donations still, so please visit the website for any donations that you're interested. As we move into this facial covering stage in our shelter in place and our look forward to new normalcy, face coverings are going to become really important. So we're going to be putting out a call to action for folks that are interested in donating those, what we call the soft cloth facial coverings. And please, if you have those laying around, or if you want to just get in there and make up a few of them for our community, please do so. We're welcoming them. Our plan and goal is to just have facial coverings available at city buildings as we start to reopen or as we start to move into some form of normalcy. I've asked our staff to look at purchasing those as well, so that our police officers have them in their vehicles, our fire folks have them in their vehicles, and our staff have them at front desks whenever the city opens up again. So we're really interested in making sure that our community can comply with this new order, and we're also here to support you in doing so. Again, please visit the website, cityofberkeley.info /COVID-19-unhoused, and visit our website for any other additional information. Thank you.
Thank you so much, Madam City Manager. I think you touched upon an issue I think it's important to highlight, which is even after the shelter-in-place order is lifted, it will likely be the case that people will need to wear facial coverings when they are outside. And I know we're going to get into that when we answer the questions. But we can't assume that we're just going to go back to the way that we lived before this pandemic happened. Our world has forever changed. And I certainly know that on the city council side and the city administration side, we know that this pandemic is going to impact our city budget. And we are going to have to prioritize essential city services. And we're going to have to prioritize funding to address the needs of the health and safety needs of our community. That is first and foremost our top priority. But while we are working to level off and help flatten the curve, we do know that people will be at risk even after the shelter-in-place order is lifted. So those directives that our health officer, in coordination with the other health officers in the region, have issued are extremely important for us to follow to keep you and your family safe. So with that, I want to turn it now to questions, and thank you so much for updating us about your work. First, I'm going to direct some questions to the city manager. There was a question around childcare, and I know this is an issue we addressed last week. Is there any help coming for childcare, particularly for essential workers and individuals who are low income? So wondering if you can address the issue around not only Berkeley, but other regional partners working to provide affordable childcare for essential workers and for low-income families.
Thank you, Mr. Mayor. I will say that I think this is one of the areas where we need to do better. There hasn't been a significant push and implementation of any major child care facilities that are opened up for our entire community, especially our first responders and essential service workers. This is an area where we will keep pushing forward and working hard to put something in place. So we're going to need a little more time to get that lifted up, but we will continue working with our regional partners to do something that's beneficial to everyone. Thank
you very much. The next question was around elections. We are in an election year. We not only have a presidential election, but we have a city election. And the question was around the process of obtaining signatures in lieu of the filing fee. And also, if you are a candidate, you have to get nominating signatures to be nominated for the ballot. The question was, how will the state of emergency impact our election timeline? If the shelter in place continues through May, would the city consider waiving fees that would normally be waived by gathering signatures? And I know that there are certain legal requirements in state law and in our city charter around obtaining signatures to waive filing fees and obtaining signatures to qualify for the ballot. At the present time, the governor in his executive orders has not suspended any of those regulations, but I'm wondering, Madam City Manager, if you can elaborate a little bit about what our city staff, particularly city clerk department, is thinking around how, the election timeframe, the implementation of elections given this pandemic.
So while I don't have a really good answer here, Mr. Mayor, I do want to say that signatures, and I would just give some general information. Signatures in lieu period starts on May 29th. At this time, there's been no guidance from the governor, the Secretary of the State, or the Register of Voters regarding any changes to the petition and candidate nomination process for the November 2020 election. If the conditions in late May warrant modifications to their existing city charter or the elections code regulations, we will explore all options available to ensure that things are fair and equitable for all of the candidates. At this time, that is all the information that I have around elections. We will be continuing to reach out to our regional partners and to the State Register of Voters Office and to stay up to date on any changes.
Thank you. I know that there are efforts not only in the state of California, but also nationwide to look at how to conduct these elections, given the fact that, people, particularly seniors and other people with pre-existing conditions, are going to be still susceptible to contracting COVID-19. And so I know our Senator Kamala Harris has introduced legislation to look at mail ballot elections. I know our Secretary of State is looking at that. And we will continue to monitor these discussions on the national and statewide level and how they will impact the election, but the election will still proceed on November 3rd. So the next question was around enforcement, and this is a similar question to some of the other questions that we got. There's a concern around bicyclists not observing the 6-foot rule, and particularly the conflicts between pedestrians walking on city sidewalks and paths and bicyclists also using those paths. And some of the other questions that we had received, asked that the city not allow bicyclists to ride on sidewalks or on paths. I will note that bicyclists are not supposed to ride their bikes on sidewalks. So that is already illegal. Just because we are in a shelter-in-place order doesn't mean that you are able to violate that rule. Please do not ride your bikes on sidewalks, ride them on city streets or bicycle paths so that pedestrians and others can use our sidewalks for access. But a couple of the questions are sort of address the conflicts around multiple sort of users using our streets and bike paths. And I know that our staff are looking, and this gets to another question, our staff are looking at the program the city of Oakland has implemented to close certain city streets to vehicular traffic, to allow greater physical distancing and use of those streets. And wondering, Madam City Manager, if you can maybe address that.
Yes, so we currently are, deploying our staff to focus primarily on the pandemic that's before us, and that's been where we really concentrated, even our transportation staff. But we are still investigating, having a couple of our staff look into what it would take to establish a permit-based or community-executed version of what Oakland's put in place. It may be possible to close selected streets with volunteers and kind of own it through the neighborhoods and put signs up and barricades that helped us to strictly enforce in that regard. This will take some form of protocol and permitting, but we're looking into it. That may take us a little bit of time because, as I said, our staff are redeployed to work on the pandemic. A lot of them are working outside of their normal jobs, and they're working on projects that are specific to to our unhoused populations, getting facilities lifted up for them, transporting, putting in infrastructure needs around the city to make sure that those things can happen. So I can't promise anything right away, but I want you to know that we're considering, we're looking at it, we're researching, we're following Oakland's guidance in some ways and looking at what they're doing. Berkeley's unique and we're somewhat different, but we all want to be able to have a safe environment for our community so that people can walk and bike. While I say that, I cringe a little because part of it is to shelter in place, but in order to preserve people's mental health and their ability to get out and exercise, I've got to try to find a way to balance that. So that's what we're doing with our public works team and transportation staff. So thank you for the question.
Thank you for addressing that question. Once again, I want to reiterate, riding your bicycle on the sidewalk is prohibited in the city of Berkeley. So please, if you are riding your bicycle, please ride your bicycle in the road or on a designated bicycle path. And if you are sharing public paths, please be mindful of pedestrians and other people using those paths. And also, you know, if you are walking in the street or in a park, please maintain a 6-foot physical separation from people that are not inside your household. To ensure adequate, at least 6 feet physical distance, to ensure adequate physical distancing to reduce community spread. So the next question was around our work to move people experiencing homelessness into hotels. And this question said, I've heard on the radio that unhoused people are required to give up important items like a bicycle or tools that currently help them take odd jobs in order to qualify for services from government subsidized temporary housing in motels like Project Room Key. How can we provide interim storage for people who we are moving into hotels or in other forms of shelter and isolation? I think that's a good question. I know our city staff are working very hard to not only move people off the streets, but into trailers and hotel rooms. And the city is going to be opening up a larger shelter, indoor shelter, very shortly to ensure greater physical distancing, because oftentimes people living in shelters are in very close quarters and people are more highly susceptible to contracting COVID-19. As Dr. Hernandez had noted, we already have one confirmed case of a person living in one of our homeless shelters who has contracted COVID-19. So that just illustrates the importance of trying to move people out of cramped living quarters and to maximize physical distancing. And our priority right now is for people that have contracted COVID-19, people that are maybe more susceptible to contracting it. So, you know, older individuals, people that have underlying health conditions are being prioritized to being moved into hotels and to other forms of physical isolation. But our goal is to try to get as many people out of these cramped shelters as possible. And I'm sure the issue of storage is something that we are addressing, Madam City Manager. And Madam City Manager, I believe you're muted.
Thank you. Thank you. So I do believe the first point that you made was around allowing folks to bring in their items into some of the Safeground shelters. And at this point, while we haven't lifted up a location to store homeless belongings, our concentration has been on making sure that they have the essential things that they need into these new environments. They are allowed to bring some things with them. Clearly, large items could also pose contamination issues moving forward, but we are working with people to get them what they need into these locations. Not everything will be able to go. We do have a lot of issues around people having huge amounts of things that they like to take with them, but that's not something we'll be able to honor. But we do support them in keeping those things that are essential, those things that are critical and necessary for them to even function in the Safeground locations. In terms of the question around, I think it was transporting, we transported 22 people Operation Safer Ground. We'll be opening up more shelters. It's not a lack of space. The space isn't the issue for us. We have a lack of staff, and there's a challenge in getting basic services done, like laundry, food, cleaning, disinfecting, keeping those locations clean and running effectively. And again, I think some folks in the industry would say that bringing people in off the street into congregate care isn't any safer. So there's a balance there. Is it better to set people up in an area where they can be intense and have safer surroundings and be sheltered and isolated in their tent areas with available resources to them? There's something to be said about that as well. So we're looking at all of those opportunities, whether it is a RV, which we've secured over 18 of those in the city. That will be launched next week, where we'll be putting people into those RVs. We've also secured a home with 4 bedrooms where there will be shared space. But again, in these locations, we've got to make sure that, number one, people are safe, that things are available to them, such as laundry, food, and cleaning and disinfecting. We have to keep all of those things in play so that people continue to be safe, and that we do not put in place some environment that would push more of the exposure and or COVID-19 cases. So we're doing a lot of work in this arena, and I expect that moving forward, we'll be continuing to work with Alameda County to set up our own Safer Ground type hotel in Berkeley. We're working on that right now. So we could see more hotel space. We could see tents coming in. We've sent a letter to the state of California requesting tents for Berkeley. So we could see a number of ways in which our unhoused is separated out somewhat and made safer. Sorry
Thank you so much. No, I really appreciate you elaborating on all that we're doing to try to get people off the streets, because we had a number of questions around that particular issue. I'm going to run through a few more questions and then go to Dr. Hernandez. So one of the questions is, what is the possibility of the state, county, or city purchasing commercial properties, hotels, et cetera, provide housing and assistance beyond this pandemic? I think that's an excellent question. I think we should consider, as we are leasing hotels or properties, to think about the long-term use of those to provide shelter. And I know that the city of Oakland is looking at that as well. And I think the state can play a really critical role in assisting local governments in acquiring hotels and other properties to provide long-term shelter. One question around inspections: why are you not allowing the final inspection for construction already done for essential businesses like a restaurant? And my understanding, based on the shelter-in-place order and the guidance that's been provided in the implementation of that, is that there are certain categories of construction projects that meet the definition of essential business, and inspections of a restaurant, a commercial space that's being used for a restaurant, I don't think meets that category, if I'm not mistaken.
Right. So restaurants that prepare food for takeout or delivery, they are identified as an essential business in the order. For restaurants and other essential businesses, construction is allowed to go ahead and continue, but only to the degree it cannot be reasonably delayed. For example, construction a restaurant needs to do in order to have a functioning kitchen, that's allowed. It's allowed to continue. On the other hand, finishing work like installing, trimming, or painting, that shouldn't be done at this time, because that can be delayed. So we continue to provide inspections for constructions at essential businesses, and we posted information on the COVID-19 webpage regarding the types of construction that are allowed to continue and how to access an inspection. So if you go on the website and look under featured news on that webpage, you'll find all of the information that's needed.
Thank you very much. One question is, why can't we reopen the King track and field? We will take that suggestion into consideration. Thank you. Why is the city delaying the processing of use permits? I know that there are discussions with our planning department around moving forward projects. If there are certain sort of legal timelines that have to be met. I know that, like the Landmarks Commission, there are certain timelines for decisions and there may be certain projects that do need to be moved forward. And the Zoning Adjustments Board and some of our other quasi-judicial commissions are allowed to meet to take up projects that have sort of legal timelines that have to be satisfied. So we are in discussion with our planning department around that issue, around sort of kind of phasing in land use commissions, knowing that there are virtual platforms that can enable participation.
Yes, and Mr. Mayor, I think it's important to also note that this direction is in place until at least May 12th, and
Yes.
we'll be reevaluating that leading up to that time. But one of the main reasons for this is that many of the same staff who work as commission secretaries, they're spending a significant amount of time serving in our EOC, and our response to COVID-19 is a top priority right now. But we do have staff that are working remotely. So preparing things like meeting packets and doing the required noticing, it's a bit more complicated to get that done. That being said, all other land use, building permit services, they're available online. People can submit a land use or a building permit application electronically, and staff can continue to review those applications, and we're doing that. We're also using administrative use permits. We're also issuing administrative use permits, which do not require a hearing at the ZAP. So those are still being issued. And there is information again on our website regarding how to access those services.
Thank you.
Oh, sorry, go ahead.
I appreciate it. I just want to go to a couple more questions before we go to Dr. Hernandez, being mindful of the time. One question was apparently young children are playing in traffic circles. And this resident was concerned that for safety reasons, particularly, that children and families not play in traffic circles. You're not allowed to loiter in a traffic circle. It is technically a median under the municipal code. And so I want to reiterate, while people can walk and stroll and bike in our city streets or in our public parks, that traffic circles are not a location where that is allowed. There was one question around, is the city contemplating installing non-contact hand sanitizing stations in public places? And I know that we've installed 22 hand washing stations throughout the city, and I'm sure our staff are evaluating expanding the number of hand washing facilities as well as needed to ensure basic sanitation. And lastly, there was a question around street sweeping, which is an issue we addressed last week. Why are people getting tickets for street sweeping? We are still sweeping our streets in order to meet mandates to prevent pollution in our storm drains and in the bay. However, if people are issued a citation, they are able to submit a request to the city manager and the police department to have that citation waived. Is that not correct, Madam City Manager?
That's correct. I do want to caution, though, that what we're doing is looking at this on a case-by-case basis. We are not asking people to continuously keep their vehicles parked when street sweeping services are being rendered. It's important to note that repetitive types of street sweeping violations will have a different stance about those, but we are especially looking at one-time issues. So please help us and move your cars. It's only once a month. And if you can do that for us, it would be great. Keep our streets clean.
Thank you so much. I'm going to go to Dr. Hernandez. We got a number of questions. A lot of them were on masks, so we can dive into that. But the first question was around the governor's 6-point plan. And is the city looking at that plan? When will restaurants be reopening? When will there be a phased reopening in the city? And I know that we are looking at that 6-point plan as guidance.
Oh, absolutely. And thank you for that question. I wanted to put that in my update as well. Yes, we are firmly aware of the governor's 6-point plan and actually agree with it. And the we that I'm talking about are the 6 other health officers in the region that issued the shelter in place order actually before the governor issued his orders as well. So we have our shelter-in-place order that we are working on, and that our order expires May 3rd. So that's 3 weeks away, a little over 3 weeks away. So we are looking at what the governor has stated, and also looking at what we will do for the 7 jurisdictions that we represent. And we're looking, we have a couple things that we are using. One is a guiding principle, which is that we want to maintain the highest social benefit. So the highest benefit for society with the lowest risk of transmission. And that's sort of to honor some of the things that the governor mentioned in his presentation when he outlined the 6 points, which is that we know that the shelter-in-place order has a large impact. Some of it is good because we are seeing a reduction in our curve, and the amount of cases that we're seeing double or increase every 2 days, or every increase. And we also know that there's some bad things that are happening that we are also firmly aware of as well, such as the economic impact to mental health, what have you. So we're using those as our guiding principles. We're also monitoring closely how the COVID-19 has impacted our community in terms of their health, specifically cases that are hospitalized and hospital capacity. So I know there's been a struggle, and I agree that we need to test more people. So it's not going to be the number of confirmed cases that we're looking at. It is truly the number of people who are sick enough and have to be hospitalized, and also the capacity. So those are the measures, the indicators that we're looking at, and knowing that right now we actually have a good amount of capacity in our hospital, which is great news. But as both the mayor and the city manager have mentioned, if and when these restrictions are relaxed, we're going to see more cases. So we have to use that as our guide and goal, and that is the basic reasons why we issued the shelter in place. So we are looking at it. We're meeting multiple times a week, and actually meeting tomorrow about it. So we'll have some more information soon, hopefully in the next week or two, to release to the public, and of course to our city leadership.
Thank you so much, Dr. Hernandez. One question was, does a leaf blower blow the virus around the neighborhood? Because I know people are using leaf blowers for, to maintain their property. I'm not aware that it does.
It does not. Of course, it's noisy.
Yes, it is.
but it's not blowing the virus in the environment.
Okay, thank you. So one of the questions is around reporting statistics, and I think we did touch on this in your prior comments, that the city is implementing a dashboard which will be updated daily, showing more specific information on cases in the city of Berkeley. And the city has also been updating the numbers on its website, cityofberkeley.info/coronavirus, the number of positive confirmed cases, as well as the number of deaths in the city of Berkeley. Let me see, what's another question?
Can I add to that?
Yes.
The Alameda County has a dashboard, and we feed our data into Alameda County's dashboard as well. It should be aligned. I know there was some mentioned in a news report that there was a lag, but there shouldn't be. And some of the data that we cannot present because of what privacy issues, and because we have small numbers, meaning we have a smaller population than Alameda County, and we have lower number of cases, as I highlighted. Some of those things we cannot safely and due to privacy issues report. However, our data is fed into Alameda Counties and is included into those numbers when it looks at like age and ethnicity. If we can report it, we absolutely want to and will. It's just that we are beholden to those restrictions in terms of HIPAA and other regulations. So if we can, we will report it. If not, please know that they're reported in the dashboard for Alameda County.
And I want to thank you for implementing this dashboard. I think it's going to provide useful information to our residents. I think the dashboard is live, right? It's on the city's open. It's going to be live. It's going to be on the open data portal for the city of Berkeley.
That's there. It's not the dashboard. It's more like you could look at the case counts by day.
Got it.
You just click on it. And I think if you're more savvy than me, then you can see some graphing. I tried to do that and I couldn't, but it's a function of Lisa Hernandez, not a function of the data. But there will be a dashboard, something that like what you see in Alameda or San Francisco or some of the other counties, that will be a little more friendly. And I can use it, so I know everyone else can when we get that. And we're hoping to get it by the end of next week. Excellent.
And we'll send out information to Berkeley residents around that dashboard so people can keep track of the statistics. I know there have been a lot of questions around the statistics, and I know that we will share what information we can share under federal law. I know that there's been, particularly on the statewide level and the national level, looking at the demographics of the cases. We know that Latinos and African Americans are disproportionately impacted in contracting COVID-19, which is not surprising given that I think that just represents broader issues around health access and in our country. So going to questions around contact tracing. There were a couple of questions around what are the City of Berkeley's efforts on contact tracing when we do have a confirmed case.
Yes, I'll try to be brief, and you can tell me when to stop, Mayor, because I am happy and to talk about contact tracing, because it's the bread and butter of public health. One of the pieces that we do, which is when there's a case, and I think I outlined a little bit of it when I was talking about our response in the shelter for the case that was unhoused. Basically, what we do is when someone is a confirmed case and it's reported to us, and we receive that either through a provider report or through a lab, we do an interview with that individual. So this is any person that's a City of Berkeley resident. If you live in Oakland, that's Alameda County. But if you're a City of Berkeley resident, it's reported to us, to me, and the public health staff, the public health nurses do an interview with that case. And then we ask as well as first, how are you doing? We also ask about exposure. So, and we use the definition from the CDC, which is that you're contagious 2 days before you became symptomatic. So we ask, when were your symptoms? We are very detailed in asking about the symptoms, and then we determine 2 days before what were that person's activities during those times. And then once we get an understanding of that, then we decide who are contacts. And then we contact those individuals, and then we inform them that they are to be quarantined, and then we do symptom checks with them. That means that we are contacting the individuals. We also or communicating with the individuals. We're also remaining in contact with the case as well, because we want to also to understand how their symptoms are going, because then they can be cleared. We talk sometimes about which cases are active and which have cleared. That means they're not contagious anymore. And that's determined by someone's cleared when they're 7 days from the start of their symptoms, and when they're 3 days or 72 hours from when their symptoms resolve. So, and it's not coughing. We don't use coughing because we see that people with COVID-19 continue to cough for a long time and they're not considered contagious. So that's what we do. So in our contact tracing, it starts first with the case, doing a very detailed interview, and then we are working with the contacts of those cases as determined by that initial interview. And we are seeing that there are less contacts because people are sheltering in place. However, that will change when if and when, relaxations occur. That's what we do. And we focus also on those that are high risk contacts, those that are healthcare providers, or work in congregate settings, or live in congregate settings.
Thank you very much for that explanation. We had a lot of questions around masks, and I'm wondering if you can elaborate on the mask order that was issued yesterday. And a recurring question was why cyclists and joggers are not allowed to wear masks or required to wear masks when they are jogging or riding a bike. And then there was a very specific question around an individual who is deaf and uses implants to hear and relies on lip reading, and wearing a mask may make it difficult for them to communicate.
Right.
So wondering if you can elaborate a little bit more about the mask order. And we did talk about at the beginning that the city will be working to coordinate donations of facial coverings. And I want to thank the city manager and staff for taking on that initiative, as well as the city providing those for members of the public who do not have facial coverings.
Great. So I have the order here, so I will sometimes be looking down to refer to the actual document. So first, as you mentioned, I issued the order yesterday. It was in effect starting last night at 11:59. However, there's a grace period for businesses and individuals to get the face coverings, and to start using them. We hope, and I hope, that people start using them right away, but there's a grace period until the 22nd at 8 a.m. for that requirement to be enforced. So basically, these are face coverings, or do-it-yourself coverings, and it's described in the order, as well as there are some links to how you make a face mask. I actually have some examples here. Don't tell my mother I'm not using the one she made me, but it's something that even your mother can make. But this is one that's sewn. It has shoelaces as your coverings. Another example is the gaiters that people have, the neck coverings. And basically what they are to cover your nose and mouth. And these are required in 3 instances. Once, members of the public should wear them when they're inside or waiting in line at essential businesses and other businesses, or engaged, or when they're in facilities where they're engaged in minimum basic operations, which include providing essential infrastructure and essential government functions, including when you're seeking healthcare. So if you're a patient going to seek healthcare, you should be wearing one of these. If you're a healthcare provider, the healthcare providers are subject to the order I issued on Thursday, where they're required to wear actual either surgical/procedure mask or N95s, and that's going to be determined on the type of service they're providing. We're asking that members of the general public not wear N95s or surgical/procedure mask, because we want those to go to healthcare providers. And if you have them, you can donate them, as was mentioned by the Madam City Manager, in terms of on our link on our web, there's a link for donation. So we definitely still have a need for that. And we hope that people will donate those and use coverings such as these for when they go out in general public. So the second bucket is employees, contractors, owners, volunteers of all essential businesses, or those that are operating public transportation and transportation such as taxis and ride shares. They must be wearing these facial coverings, and those for transportation and ride share, it's going to be at all time. It's not just when you have a passenger in your vehicle. And the third is for workers engaged in minimum basic operations, infrastructure work, and essential government functions. They should wear them when they're in areas where public is present or likely to be present at any time or nearby. So those are the buckets. And then there's a specific question about what do you do if you're a jogger or a biker, and they're oh, before I go to that, well, let's go to that. So basically, it's recommended that you wear a face covering when you are biking or jogging. You're not required. However, we know that when you're biking and especially when you're jogging, you're more likely, because of the effort of breathing and exercising, to expel particles more so than 6 feet. So the risk is a little bit greater. So we would really recommend that individuals do that. We also recommend that they avoid people that are pedestrians that are on the sidewalks, and to either yield to them or wear this mask and put it over your face when you're running past those individuals or biking past those individuals, so that you are protecting those people. So that's what we're asking, is that you are not required to be wearing them, but you should have them around your neck or in your pocket so that you can use it. The question about individuals who need to read lips and if it impacts their ability to function, whether it's just in their daily activities or for work, there's an exemption there that you should do this safely. So if it's impacting your work or how you transact business or communicate with others, you don't have to wear that mask for that instance. So if it's not safe for you, you follow the local, federal, state guidelines for safety through for example, Cal OSHA, who sets safety standards. And if it's not safe for you to wear that face covering, then you don't. Same thing for someone who needs to communicate with others and reading lips. They can ask that person to remove their face covering so they can communicate effectively and safely. And best if you can maintain that 6 feet. I want to also let people know that this order does not relax all of the social distancing requirements that we have instituted already. You need to maintain that 6 feet as much as possible. You need to stay home as much as possible, and only go out when you need to perform essential duties and functions.
Thank you very much. I'll close with
Oh my goodness.
question around testing. There was a lot of questions around, is the city going to make available to any resident testing? And wonder if you can elaborate on our testing site and who we are prioritizing and how people can access testing if they need it, because they may not necessarily need to go through the city's testing site. Their healthcare provider may make testing available.
Yes, so there's more and more availability to testing in the city of Berkeley through providers because the labs are opening up, and their turnaround time is actually faster, which is amazing, and I'm really, really happy about that. As mentioned before, we do have the testing site through a partnership with University of California, Berkeley, IGI lab, their innovative genomics lab, as well as Lifelong. And we are currently seeing those that are City of Berkeley essential workers, first responders, lifelong patients, and those that qualify for lifelong services. So even if you're not a lifelong patient, if you qualify to receive their services, they will sign you up and you can get tested. And these are for symptomatic individuals, as well as people that are referred to the site through public health referrals. We're hoping to open up next week to a broader group of individuals. It'll still be not a walk-up site, and most sites are not walk-up. It'll be through appointments, but we'll have all this information on the web for essential workers. So if you are a physical therapist, for example, and you're a City of Berkeley resident, if your provider can't test you, you can come to this site and we'll test you and ensure that you get the information. So we're looking to do that next week. And if we can expand it even more, but it's through this stepwise with priority to first essential workers and to symptomatic individuals.
Thank you very much.
Mayor, if I can just
Yes, Madam City Manager.
I think as we start looking at our transition back into a new normalcy, that we should be mirroring who's tested. And I know that that's, I haven't talked to the doctor about that yet, or to our team about that. But as we start moving back in, so if we're going to deepen our construction allowances around the restrictions, if we're going to allow more businesses to open up, I think we've got to start thinking about how do we get those people tested, and how do we make sure that we're not opening our community back up to broader COVID exposure. So I'm just going to be pushing the idea around who and how and tailoring it to what we're doing.
Thank you so much. So I'm just going to address a few questions before we close. One question was around assistance available for independent contractors who are freelancers. And there is assistance for these businesses at the state and federal level through unemployment. And as we are looking at the second round of grants through the Berkeley Relief Fund, we will be considering opening up that assistance for independent contractors. One question was around businesses like CVS Drugs taking credit card payments only, and why are they not allowed to do cash payments? While we are encouraging the use of credit cards over cash, we understand that not everyone has access to a credit card or debit card. The City of Berkeley actually has an ordinance that does allow the local businesses to accept cash payments. We do understand that some have temporarily suspended accepting cash payments just to minimize the spread of COVID-19. Ultimately, it's up to those individual businesses how they want to handle transactions. Couple of other questions. This individual had not received their federal stimulus check. How can they track it? Payments have started to appear in people's bank accounts starting this week, and it will take several weeks for those payments to reach all those who are eligible. You can go to irs.gov and click on Get Coronavirus Tax Relief. Get Coronavirus Tax Relief to track the status of your stimulus payment. Number of questions around street closures, which I think we addressed. Our city manager and staff are looking at Oakland's program. And then there were some questions around wood burning. The Bay Area Air Quality Management District has declared a spare the air period, knowing that some people may be more susceptible to being impacted by wood smoke if there is wood burning during this period. And so, particularly people with respiratory conditions. So the Bay Area Air Quality Management District, which does regulate emissions, has issued a spare the air period. And so people are discouraged from burning wood or synthetic logs to minimize air pollution and the impact on people with asthma and other respiratory conditions. So I think that encompasses most of the questions that we received. If we did not get to your question, we'll definitely get to it next week. But I just want to close by thanking our city manager, Dee Williams-Ridley, and our health officer for not only participating, but their incredible work during this difficult time. We're really fortunate to have such dedicated and excellent public servants serving the Berkeley community. And I want to remind everyone that we will be doing another one of these town halls next week at 12 o'clock on Saturday. We will send information out about how people can submit their questions. And please feel free to reach out to my office, mayor@cityofberkeley.info. If you have ideas or questions throughout the week, we're happy to address those. And we are here to serve you. City Hall is still open for business. And I want to thank once again you all for participating, and please stay safe. Thank you.